I'm Dr. Thomas Gerber, the Mayo Clinic Proceedings Associate Editor responsible for our journal's online and social media presence. I'm also a Professor of Medicine and Radiology at the Mayo Clinic College of Medicine and a staff member in Cardiovascular Diseases and Radiology at Mayo Clinic here in Rochester, Minnesota. Today, we'll discuss the editor's choice and the highlights in the October 2014 issue of Mayo Clinic Proceedings. Our editor's choice this month is an original article authored by Dr. Walter Rocca and colleagues on behalf of the NIH-supported Rochester Epidemiology Project at Mayo Clinic. They describe the prevalence of multimorbidity involving 20 selected chronic conditions in Olmsted County, Minnesota. An accompanying editorial from Drs. Posner and Goodman from the Centers for Disease Control and Prevention in Atlanta, Georgia, points out how important such research is to improve the understanding of the complexities that multimorbidity poses for both the clinical care that we provide every day and for public health programs and policy. One of the highlights in this month's issue is an original article authored by Dr. Daniel Kotz and colleagues from the Netherlands and from the United Kingdom. They report on the effectiveness of smoking cessation treatments that are used in the real world. In the accompanying editorial, Dr. Taylor Hayes from Mayo Clinic in Rochester, Minnesota, discusses why smoking cessation interventions that appear to work well in controlled research settings do not work nearly as well, or not at all, in the real-world settings of our clinical practices. Another highlight in this month's issue from the investigators of the multi-ethnic study of atherosclerosis, also known as MESA, is an original article about the association of coronary artery calcification assessed by cardiac computed tomography and coronary heart disease events in young and elderly study participants. The accompanying editorial, which I had the privilege of contributing together with Dr. Birgit Cantor, discusses what coronary artery calcium imaging may add to conventional cardiovascular risk assessment in these two patient groups. And our third highlight, which comes with CME credit if you complete the appropriate documentation, is a concise review for clinicians on mild cognitive impairment and mild dementia, which are both common presenting symptoms and for which patients and families often request answers and advice from us. Online access to these editor's choice and highlight articles is free during the month of October. For more information, please visit our Mayo Clinic Proceedings website. And we'll see you again in November. Thank you.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.com. This video content is copyrighted by Mayo Foundation for Medical Education and Research.